Welcome. As folks continue to trickle in, we're just going to get started. So welcome. My name is Dr. Rhea Boyd. I'm a pediatrician and public health advocate who's been working with 211 and health leads on a project that we're so thrilled to introduce to you guys today. So this is part one of our introduction to talking about our data equity framework. We're specifically going to focus on how you can design equitable and inclusive data systems. Thanks. Yeah, next slide. Thanks, Karis. So I see folks already using the chat. I love it. What we would love if folks can mention in the chat along with your morning salutations is your name, your organization, and where you're logging in from. And then as you're putting that into the chat, we also want folks to spend these first few minutes just thinking about your own intentions for your experience today. What experience do you bring to this session already? Are you or your organization already advancing an anti-racist agenda to your data practice? And then what knowledge do you hope to take back to you and your community? So in the chat, please share your name, organization, and the location you're logging in from. And just spend some time just thinking through what experience you bring to this session and what knowledge you want to bring back to your communities. We want everyone to have an intention for their time with us today so that all of our goals are met. On the left here, we're now going to go through some of our goals for our time together today. So you're going to meet our team and we'll go through the folks who have worked so much on bringing you this data equity framework. Our team's going to first introduce kind of what led us to this framework and the mindset that we want folks to approach the framework through. So we're going to tell you how to use it and also just how to approach thinking about using it. Next, there's going to be space for us all to reflect on some of the drivers and the ways that we design our data equity framework, and to reflect on how that might align with or be perhaps a little bit different from the way your organization approaches data equity or data gathering and use in general. And finally, together, we're going to consider how we can move as sectors and organizations towards more equitable systems. We are so thrilled today to have about a quarter of our audience be folks from nonprofit organizations. Another quarter of y'all are from healthcare organizations. We have great representation from community-based organizations and other nonprofits. And so we're so thrilled to have such a broad representation of folks who work in the social service and healthcare service sector. Next slide. Before we begin, we want to thank our very generous sponsor, Robert Wood Johnson Foundation, for helping fund this work. We all know that the work towards anti-racism is work that takes resources, it takes time, and we're delighted that 211 and health leads have been supported so that our team could do this work. So thank you, RWJ, for all of your work to make this session possible. Yes, next slide, perfect. So this is our team. This is a slide that represents folks that you'll hear from today and some folks who you may not hear from, but who are on today, who all contributed to the creation of the framework that we're going to present. Each person, before they begin their section, will just give a brief introduction to themselves, the organization that they work with, and some of their role in creating the framework. But this just gives you an idea of the faces behind the work that you're going to see today. Next slide. So now I'm going to begin with a little bit of a background. So one of our goals was, how should you begin to approach, or what mindset should you have when you're considering the data equity framework that we're going to present, or where your own organization is? And so these are some of the concepts that we used as an authorship, excuse me, as an authorship team to set this data equity framework. And we want to be really clear about these terms and what they mean so that we all have shared understanding around how we are approaching this framework. So first, we're going to start on the left and move to the right. First, we want to talk explicitly about racism. Sometimes in the equity conversation, we lose the fact that the reason we need equity, the reason there is a need to respond to inequity is because of how racism functions in our society and thus within all of our organizations, at the individual, at the institutional, and at the broader society level. And so here we pull from the teaching of pediatrician and scholar Kamara Jones, Dr. Kamara Jones, who teaches us that racism operates at multiple levels. Again, both at the individual level, where that racism might be experienced as prejudice, but also at the institutional level. And that's the type of racism that we want to take on when we're thinking about data equity frames, the type of racism that gets baked into how our organizations function, independent of any of our individual perceptions or desires or intentions. And then how sometimes that racism can also be internalized, the ways that we can sometimes overlook the ways racism functions because we also hold those beliefs about ourselves or our own communities. So as we approach this work, we want to overcome and be very conscious about the ways that racism is already operating in our organizations and systems so that we can hope to approach a truly equitable frame. And I want to also note from Dr. Jones that she notes that structural racism is advanced through individual choices that provide or offer differential access to goods, services, and opportunities by race. I think that's really important because sometimes when we talk about racism at the institutional level, we miss that what makes up what happens in our organizations is based on what we decide and the choices that we make. And so as we go through our presentation today, there'll be multiple spaces where you'll see that there actually are decisions to be made, even if you joined an organization and that's the way things already were going, that the reason things go that way is because somebody decided they go that way. And so we'll talk about how we can make different choices as an example of an anti-racist action. And finally, structural racism as often shows up as simply inaction, as doing nothing. And so also what we're talking about and the mindset we hope you come with is that we're actually asking organizations to do something, not to feel something and not to say something about how we feel or believe or our mission statement of our organizations. We're actually asking organizations to do something different, which often will be manifest in making different choices. And we'll walk through concretely what those choices can be. Now to the middle, do no harm. So for the quarter of folks who are joining us from the healthcare sector, you're familiar with this term, which often is taken from the Hippocratic Oath, the oath clinicians take before we practice, where we say, you know, we want to heal people if we can, but at the very least, we don't want to hurt people. But when we're talking about data equity, and specifically when we're talking about what anti-racist practice means, do no harm isn't enough. We have to think beyond just not hurting people to also think about what we owe people so that people can be well, can be autonomous, and can thrive independent of our systems. And so here we're calling people to recognize how poverty, class, racism, other forms of trauma, and other forms of social inequities, including sex and identity-based inequities, affect people's ability to thrive. And because we know it affects people's ability to thrive, we can't just simply not want to hurt people anymore. We have to take explicit actions to make sure that people can thrive. And so we talk about in this box here, and we'll share the slides with all the attendees if this is helpful language for you to use in your own organization, that it's important for us to honor the contribution that our patients and our clients and the communities that we serve make to our organization by offering us their data. And that one way to honor them is to not only not harm them, but to make sure that they actively participate in setting the goals for that data use and that they benefit from the goals of that data use, which ensures that our community has a real voice in the programs that we end up creating. And finally, a central thrust of what we're working towards is an explicit articulation of what anti-racism can look like in your organization. At this point, many of us have been in rooms where anti-racism has been discussed. Perhaps you've read books about anti-racism, and it still seems something kind of ethereal, something we think about, but not necessarily something we know how to implement and practice. And our goal here is to be incredibly concrete about what it might mean to practice anti-racism as a set of actions that respond to how systemic racism and structural racism in particular truly is. And so when we're talking about anti-racism, we're talking about the process your organizations are going to go through to move towards what we frame as a liberating community information exchange system. And we'll talk through what we mean by that language. The benefit of practicing anti-racism is that it offers opportunities to reimagine ways of understanding and addressing human needs. So it gives us an opportunity to rethink how we've oriented our organizations or perhaps even our own roles towards the communities that we serve. And it also offers opportunities for solidarity between us as organizations from various sectors, like the folks who are joining us today and the folks we work with, and as individuals who are part of systems that have historically and currently harmed communities, particularly communities of color, and particularly Black and Indigenous communities, and being really upfront about what we're doing to redress that harm. So as we go through our presentation today, there are a couple of things I just want to orient folks to. I see a lot of folks have dropped information in the chat. If you are just logging on, please share your name, organization, and where you're joining us from in the chat. You can also, if you would like, share comments in the chat as we go along. And there's also a Q&A button at the very bottom. It's the fourth, is that fourth? Fourth to the right. If you have a question, drop it in the Q&A as we go, and we'll take up questions along the way. And there will be 20 minutes at the end for us to have open discussion where we will also read out all the questions. Hopefully we'll have time to get to all of them and respond to them. So feel free to use the chat and the Q&A button as we go along. And now I'll pass it along. Next slide.
Thanks, Ria. So super helpful framing on what we're talking about today. Before we kind of launch into our framework and some of the concepts that Ria's really kind of structured us around, we want to talk a little bit before you see it to kind of understand where we were coming from. So this is a strategic visioning kind of framework. This actually came from Rishi at Health Begins, kind of helped us to articulate how to use this, but it's really about like the past, which I think Ria kind of helped highlight, like our past, our present, and our future, and where organizations are trying to move towards. And so again, we're just helping, once you see the framework, the idea is to kind of view it, understand where you are on this journey as we're trying to move towards an anti-racist framework, see where you're at as an organization or as an entity or as a CIE, wherever you're at, how things really are. Where are you? This is meant to be a reflection point to be able to kind of reflect on where you might have designed things as an organization or thought about things as an organization to kind of help to operationalize and really think about how to do things a little bit differently. So again, this is really helpful to set. It's not meant to be offensive or for people to get defensive, but to kind of set you up to be able to think, okay, where am I at as I think about how I've designed my system, my program, my organization, how I think individually, and then really to set intentions for the future. So where can we accomplish? I think Ria helped us frame in the frameworks of racism to anti-racism and do no harm. Where can we take action and where can we start doing things differently? So we'll be walking through these system designs, the way that we've thought about systems and how to create them, and then the drivers that might be leading to more of a predatory model versus a liberating model, and what action can be taken along that journey to help frame it. So that might be a good way to start thinking about it. And another mindset feature we wanted to help line people up on, I kind of already mentioned, this is a reflection toolkit, a tool, not necessarily, or a strategic visioning tool, not necessarily something you can take. And we are really intentional about the fact that this isn't like, take these 10 steps and you will not be anti-racist anymore. This is really helping to facilitate conversations within your organizations. It's an opportunity to think, figure out within your organization, your individual program, or your as yourself, to think about where can I reflect and think about things differently, where are conversations that need to be had. It's really meant to be a tool to help you guys start this conversation. And so that's kind of lead into our second point of the mindset is this is again a starting point. This is a framework to help you guys think through things. It's going to be evolving and changing. We don't have all the solutions either. We're not saying, even as a San Diego CIE, which we're kind of framing some of these concepts around to move towards liberating model, we are not there yet. We're still figuring things out. We have a lot of work to do, but this is a helpful starting point, even for ourselves, to help think about where we want to go as a community, and in hopes that other organizations or CIEs or programs or individuals would like to use the same framework to kind of start doing things and making those changes. And then the last point we wanted to talk about, and we highlight in the toolkit, is really the framework to use beyond data systems. So we are focusing specifically on data systems, but as we kind of move into the drivers, you'll see that these are organizational changes. These are people changes. This is not just technology or data. This is the infrastructure in which we operate, the way we think, the way we interact with people. And so we really think this framework can be leveraged for many things, not just data systems. And so I think as you guys start reflecting and looking at this tool and this framework, our hopes is that you can think beyond just data systems, but how can it be applied elsewhere? And I'm going to kick it to Arter. And I forgot to say my name. I'm also Carrots Grounds. I'm with 201 San Diego. And there you are, Arter.
Thanks, Karis. I'll do that earlier then. My name is Arter Rogers, and I am speaking to you from Health Leads. I'm going to start off really setting up or talking through this landscape of data system design. Really, we wanted to highlight how the intention, whether conscious or unconscious, how it shapes how a model positively or negatively impacts the community. And so we started to think about that through 3 axes. So one is the beneficiary of the system. So who benefits most? And one way that we heard of the ultimate beneficiary was who actually has the most decision-making rights and power in the intervention. Next, we have the impact on the oppressed community. Are we exploiting the community? Are we trying to facilitate individual agency? Are we thinking beyond to not only the individual, but the community as well, to promote community autonomy? And then lastly, we think through the fact that, hey, any type of system has the ability to cause harm. So what is your strategy to address that harm? So ultimately, a system that's put in place to benefit the impacted community or the most impacted community empowers the community to lead, and is anti-racist in commitment and practice, and will do the best to liberate and benefit the community. On the other end, we see systems designed to benefit the institution or the bottom line. They're not created with the community in mind, and often create more harm than good to the community. So we're going to move on to the next slide. Oftentimes we hear or we get a lot of feedback on the system types. And as you can see, there's a range of types of systems that appear here on your screen. You see predatory all the way to liberatory models. So some of the characteristics behind that, we said saber design acknowledges systemic oppression, while equity empowered looks to dismantle that system of oppression, and then liberatory models eliminates systemic oppression. One thing that we want everyone to understand and really want you to reflect on and interrogate is that this reflection can be looked at from the entire spectrum of your intervention. You can have aspects of your work that's ally design, while other parts can be passive and actually predatory. And it's important to interrogate this because we do not want our work to be anti-racist on one end, or see to be anti-racist on one end, and then harmful on the other end. And this definitely happens in work through the social determinants of health sector. For example, we go out and bring more and more people into a room. We're looking to increase the diversity, and we want those with lived experiences in the room making decisions. And I believe that we all applaud that. However, often in the same intervention, we can look how data is collected and how it's used. We may see coercive screening practices where data is collected and Clients have no idea where their data is going, how it's being used. And I'm pretty positive those clients, especially those who are coming from historically marginalized communities, do not know that their data about essential needs or resource gaps also has a commodity function. The commodity function of data becomes increasingly problematic when we see or hear about technology companies having huge profits off of that data, which really comes on the backs of those from marginalized communities, often coming from communities of color. Anti-racism does not allow us to be quiet about this. It challenges us to think about what partners we align with. And as Ria mentioned earlier, we have to think about what we owe these communities for the data that we're using. We've also heard from CBOs, especially those led by leaders of color, talk about the other end of the data process, them being asked to put data into systems where they either receive no benefit or very marginal benefit for participating in the use of a technology platform. I've heard a CBO leader say that there's a mismatch in investment toward tech solutions where they get more money to refer folks to simply talk to a CBO or to a social service organization. And they're the ones who are doing the hard part of actually getting community members resources that they need. So we have to reflect and interrogate, one, if community members and CBOs knew the full extent of what was happening with that data, would it yield more trust or reinforce historical and current distrust? Two, we have to say, would the community see the approach that we're using as an act seeking to facilitate equity, restorative justice, and liberation? And if those answers to those two questions are no, we must ask ourselves, why are we not doing things differently? And this is a part of the reflection we want to take place at both an individual and an institutional level. And we hope that this reflection leads to action. So I'm going to pass it over to my colleague, Artrice, who will walk us through that reflection more clearly.
Good morning. Thank you, Arter. My name is Artrice Morrison. I'm the Director of Programs for Health Leads in California. And I want to, when I enter this work, I think about the 25 years in working in nonprofit, developing programs and leading colleagues and clients through systems that find themselves to be often the savior design. And so I also often think, if I knew then what I know now, I'd make a lot of changes and approach my work differently. So when we think about what Arter just shared with us around the y-axis and the x-axis, and we talk about the categories of program design, and we bring them all together in this framework, we see this marrying of who the beneficiary of the system is. Is it the institution? Is it the impacted community? We see, what is the strategy to address harm? Is there intentional harm happening? Or is there an anti-racism commitment that's not just being stated in our equity statement on our website, but actually put into action through our policies and our procedures? We then look in terms of the impact on the oppressed community, exploitation, customer agency, community autonomy. And when we look at this particular framework, you will notice the red dots really talking about the limiting barrier, because we are so conditioned in our design models to think about predatory, and even if we're not thinking about being predatory, it then at times happens in the development of what we're trying to do. Our passive, approach, our savior design approach, and our ally design approach, we ask for input. We've already created a program. We have a little focus group. We ask for two or three tweaks from the community, and then we say, oh, this is fully endorsed by the community. When often that is not the case, because the community doesn't really understand and hasn't been shown the impact of what these decisions and choices are made from the institution. But that limiting barrier really allows us to really kind of acknowledge that there's a lot of work to do. This is, as Kara shared, this is not a report card. It is not a blueprint for if you do X, Y, Z thing, you will no longer be racist. You will no longer, have a model that is savior design. What we're saying is take a moment, reflect on what it is that you are trying to do, and are you doing it effectively and efficiently with the community at the center of what it is you're trying to do. When we think about this continuum, it's really not the straight line, though we show it on this reflection tool to be able to see this. You will see this jagged anti-racism process. That is a representation of the struggle that it takes. I like to call it the Valley of Insight, because we think, wow, okay, I'm open to these new experiences. And then there's a misstep or a mistake, or like, oh, I'm not quite sure. But that is the journey. The journey is always moving forward, taking a step back, moving forward, taking a step back. And then as we move from equity empowered to liberatory model, we see that it really is a changing of the structural systems, not necessarily just the ones that you have control over within your sphere, but you are calling to action those who have power in the larger spheres of our world. So that we are thinking about not just your hospital, but the healthcare system in general that needs to be changed. Not just your school, but the education system in general that needs to be dismantled and put back together for the benefit of those who need it. Next slide. So we talk about the institution. However, institutions are not just, and I say this often, brick and mortar and laptops, and now our bedrooms from our virtual offices. It is the people. It's the individual, and we bring to the table, we bring to the conversation, we bring to our work, our approach and our biases. We are the ones who execute, create, and can dismantle policies and procedures within our own organization. So we need to take a moment and reflect. We need to reflect that we are now, as individuals, part of this institution. And so what you will see on this slide, which is different than the first slide, that it looks very similar, but if you look at the y-axis on this, you will see the focus on the needs and the priorities, both internal and external. Are you me focused? Are you others focused? And when we say others in this context, we're talking about the people you touch, the people in your organization, your staff, your clients, the people you see. Or are you the most marginalized focus, where the people you do not see, the people you do not touch, but you are focused on their needs and their concerns? We look at the Y2 axes, we think about how we view power, both internally and also externally. Is it no power given? You retain all of the power. Do you give power to others, which in itself shows a power dynamic structure? Is it a recognition that marginalized communities have their own power that you may not even be aware of or be invited into? And is it respecting that power and honoring that most marginalized community power? When we think about the impact on the oppressed community, is it exploitation? Are we engaged in discrimination? Are we engaged in inclusion, equity, liberation? So really, it allows us to really think about ourselves and what we bring to this conversation and the community. Thank you. Next slide.
Good morning. I think this is me, Artrice. Hello, everyone. My name is Tanisha Rowe. I'm with 201 San Diego. And so I have the pleasure of co-presenting on our system design with my colleague, Roxanne. So it's important that as we're reviewing the landscape and the system design, as my colleagues have expressed previously, the goal ideally is a liberatory model. However, as it's been expressed, identifying, your institution systems types and the characteristics, and then also taking into consideration your individual role within the system. Often we hear the system is doing exactly what it's designed for. And so one of the things in that conversation and the tension with that is that I, as an individual, how I show up in my institution, having worked in the nonprofit CBO space for over 20 years, like my colleague Artrice, you know, knowing hindsight is always wonderful, but knowing what I know now, where there was harm that was done on my behalf, whether it was intentional or unintentional. And so I think it's really important to just kind of on an individual basis to sit with that, and also understanding at how our biases and our prejudices in looking at equity and anti-racism, how they show up in the system. And which leads to that this is a continuous reflection, a continuous evolution. You may not know exactly where to start in the system design. And these are tensions and conversations. And I say identify your colleagues. Next slide, please.
Thank you, T. So hello, my name is Roxanne, or most known as Rox Suarez, pronoun she, they, and I too work with the 211 San Diego CIE team. What we wanted to share with you when we're talking about the data system drivers is really understanding that each of these elements really have multiple decision points within them. And depending on the decisions made and how you've implemented aspects of these drivers, they have a real consequence in terms of whether or not you're building a system that has equity, an equity framework. And so what I'd like to do is dive in a little bit more into an example in a moment. But before I forget, I want to share that really some of these drivers are looking at, who are your primary decision makers, as Arter had shared earlier. And, what protections are in place? Are there protections in place? Who benefits from those protections? Are you building a system that is interoperable, or are you building a system that really hasn't a built-in expectation that others adopt your technology platform? I imagine most of you have had a chance to review these, but you can go into them more depth. But I'd like to highlight informed consent as an example. So on the next slide, we'll share with you how we have defined informed consent using this framework. And what I'd like to highlight is that when we apply this tool for informed consent, it brings in the question of whether the textbook, definition of informed consent and what is, considered a HIPAA compliant, a legal form of consent, which, is 14-point font size and is in someone's primary language, it begs the question of who established those standards, and does that truly give someone an opportunity to give informed consent? And so on the left side of the screen, you see examples of predatory model, which we've outlined as not being informed consent. There often are times, as Arter shared, that someone's individual data could be shared and they're unaware. And as we move through the passive and savior design and ally design models, this is where you're seeing really the textbook example of informed consent, which is helpful. And I want to highlight is really in the example of CIE San Diego, what we have based much of our own informed consent models off of. But as we apply this framework, as I mentioned, it then becomes the question of, is a consent form a barrier in and of itself? And I share that with knowing that often we hear from service providers that are participating in our own model that it can be challenging to be able to have a conversation with an impacted community member and to be able to explain the purpose of the consent form and to feel confident that they're able to speak to the extent of how information could be shared. And so this is an area that we ourselves are grappling with in terms of, how might we rethink what constitutes an informed consent, and then to be able to actually implement that and still work within an existing legal and institutional framework. And so I wanted to pose that as, an example of an area where there is some grappling and unraveling and, steps that we need to take in order to be engaged community members and build more trust and to be able to pose a challenge to put more weight on an impacted community members' understanding of informed consent over perhaps a standard that may not work for them. And so I'm not sure if the poll went up, but we wanted to get a feel from our audience as to how they perceive informed consent. And I'm not sure if it's up for the audience. There it goes. Thank you, Megan. So really wanted to pose the question, what currently defines informed consent from your perception? And then further, who should define informed consent? And so as we wait for those to come in, I'll turn it over to Ria to help us reflect.
Thank you, everyone, for introducing the framework. We know that was a quick run through, and again, we'll share these slides with folks afterwards. But can we see the poll results? Can those come up for everybody to see? Oh, great. Okay, so let's start our reflection here. So the first question, as Rox posed it, is who or what currently defines the informed consent process? And it seems resoundingly everyone thinks it's law and policy. As panelists and hosts, we couldn't vote, but I also was going to vote for that. I don't know. Can we give like a round of hands? How many people among the panelists also thought it was law? Which again is very fascinating, right? Because we started talking about how structural racism is the type of racism that's baked into policies. And when it comes to informed consent, all of us, many of us on this webinar have acknowledged that the informed consent process is also one of those processes that's baked into how we function as organizations. And then I think there's a broad acknowledgement that, the various sectors that we work in also contribute to how the informed consent process is perceived and experienced by the patients and clients we served, but the foundations of it are driven by the law. And I think that does tend to be true. There was 8% of folks who thought impacted community members defined informed consent. And I would love to hear from that 8% in the chat or in the Q&A about what made them say that. I wonder if it's that, what should define informed consent perhaps is affected community members. So let's go to number 2. And that's basically what people have said. 91% of people are like, it shouldn't be the law. It should be communities who get to set what determines that they were well enough informed to have been able to make a conscious choice, and to have been able to make a choice also to refuse certain services. It's Professor Ruha Benjamin who teaches us both about informed consent and informed refusal, that we're also empowering people to be able to consciously say no at any point in the process, even after they sign the initial waiver that allowed their data to be shared with us, even after their data was then shared across all of our community information exchanges and all of the networks we're connected to, even after they received a service from one of our organizations. At any point, we also are trying to inform our clients so that they can say, you know what, that was enough, or I didn't like how that went. You can't have my data anymore. And that process is transparent as well. So the poll is super helpful because I think it showed some of the work that we have to do. Okay, so now we're moving into Q&A. So the goal of this is that we all have some space just to reflect on what we've heard today, answer some questions that have come up. There are a bunch of questions, so I'd love to just jump into it. The first question comes from Andrea Shore, and I'm going to direct it towards you first, Artair. Andrea asks, can you give examples of profiting from the data? And I know you had mentioned that in your section. What do you mean when you say that?
Yeah, I think it really naturally builds off of what you were talking about, Ria. So this understanding and awareness of what is happening with my data, how is it being used? Is my data going to an algorithm or a machine-based learning software to create a narrative about me or my community? And I didn't sign up for that. I just was given data to get connected to this resource. I didn't know that all of these things were going to happen after I signed my data over to you. And so because of that, you have a situation where a lot of people are able to commodify that data in a way that they're able to profit off of it, whether it's through machine-based learning or whether it's through being able to give that data to different stakeholders. And so when we were bringing things up, I think, Rox, you did a great job talking about informed consent. I look at, like, what would it look like if we were holding ourselves accountable to an anti-racist framework to be able to just be transparent of what's happening with the data all the way through, and allowing people, like you said, Rhea, to be able to opt in. And I love Rob Benjamin talking about informed refusal of, like, hey, I don't want to participate in this part of the process. Because if we don't have that informed consent and that informed refusal, we could be, maybe even unintentionally, profiting off of data. And it's really data that comes from people's, acknowledgement that they need help or they have this resource gap. So that's what I was referring to. Rhea.
And I just wanted to piggyback quickly from what Artera is saying. Like I said, coming from the nonprofit field for the last 25 years, I have watched us profit, and then not in the terms of like, oh, I'm money grubbing and I need this, but we justify it by saying, oh, if I get this money from the government and I give these names of the people who are living with HIV, or if I give this information of who is on Medi-Cal or on, CalFresh, then we will receive our funding from the government. And even if it's blind, even if I don't give exact addresses, but I give like zip codes and I give demographic information, but we at no point told them, you getting this, well, you will receive food from us. And then therefore, we're actually going to take this information and give it to the government so that they can give us a check. We at no point ever talk about that. We just say, oh, we need this information from you. So that's an example of how that works with all good intentions. The same thing happens with foundations and grantors. They ask, well, who are you serving and what do they look like and what neighborhoods are they in? And when I give you all that information, you then will give us a check so that we can run our program, and we feel that's justified. But when we're talking about dismantling programs and dismantling systems, it's not just refusing the check from the people that you feel you need to run your program. It's saying, why are you asking for this information? And how does that make your work any better on a government level or on a foundation level? Thank you.
Thanks for that, Artrice. Love it.
I really appreciate that too, because we had a question, Artrice, from Annie Zhao that said, do you have any suggestions on how to advocate with donors to accept a more equity empowered or liberatory model instead of having the emphasis be the donor's data requirements? So I feel like you answered that question well there, Artrice. Annie, I hope that was helpful. Drop in the chat if you feel like it wasn't. So there are a couple of questions that are on the same wavelength, and I want to just combine them. So one comes from the chat from Josh Greinewitz. I hope I said that correctly. Josh says, I have heard of institutions conducting truth and reconciliation exercises to take a real accounting with accountability of the racist history to establish a new baseline to build trust. Would you recommend something like this as a step 0 in the anti-racist framework process? Where can organizations begin to recognize, own, and shift power dynamics with community? I want to combine Josh's great question about should we all start with truth and reconciliation with a question also from Hui Nguyen, I hope I said that appropriately, who asks, at which level of management do we start? So Josh says, should we start with truth and reconciliation? And Hui says, where in the organization also do we start? And how do we motivate employees and educate them? And I'll start this off with maybe Rox and T want to take this one on, and then we can pass it from there.
Excellent. If I'm understanding the question in terms of truth and reconciliation, I would say truth and having experienced something like that with a previous community-based organization that I worked with, where harm was done and the community held that individual accountable with reconciliation and healing and some practices put in place. I would say that is a great place to start. However, I would say that it takes a lot of work and you have to move very deliberately and intentionally. And it's not just a one-time thing. I think one of the most important things that I would like to emphasize is that this is continual. It's a continual process, even as, you know, asking this right now, reflecting and doing that individual and how I sit within the institution. So I would say yes. And I would say there are some great practitioners out there that do truth and reconciliation work. If your organization or your community is not skilled in that, I would say seek those individuals out because it's very important that you do it correctly. Thoughts, Rox?
Yeah, I agree. All of that, and to remember that me slide that we shared, like recognize that there's personal work, that this is an ongoing personal journey, and as you're entering these spaces, you have to be willing and ready to have incredibly difficult conversations and acknowledge that you yourself may show up in spaces that is harmful and unwelcome. And so, yes, it's starting with your leadership, it's starting with yourself. And in some ways, I think that's kind of ground zero as you start to enter these conversations, both within your organization and with community members.
Thank you, guys. I also think we captured here, Tina Thomas, your question, which was one piece to this reflection work at different points of design and implementation is the time it takes to reflect and reassess the work. And then Tina asked, can anyone share strategies you might use for institutional buy-in to slow down and do this work thoughtfully? And I think, Tina, your question was answered by T and Rox and by Josh, that truth and reconciliation is a process that organizations go through to slow down and reassess what their impact has been and to create a strategic plan to address the harms of their impact. Okay, there are a bunch of questions about specific examples. So we're going to start with Artrice and then Artair, and I want to hear from everybody on this. Both, how do you approach this question about specific examples? Because I knew it would come up. When we present frameworks, people are like, it's great to have a concept, but I need something more concrete. So I'm going to read through a couple of questions. One of the anonymous attendees said, examples and specific behaviors for each of these types of organizations or stages, like predatory design, ally design, et cetera, would be helpful. That maybe Artair, maybe you can take on about like the specific examples. Maybe you can offer one of predatory versus ally design. And then Michael Pamnit asks, are there real life examples of informed consent within a liberatory model? And how do we avoid unheard voices when seeking community defined policies? And I feel like maybe Michael had one more. Yes, Michael had one more. At the start of the webinar, we mentioned that it's a framework and not a blueprint, but is there a blueprint for a liberatory model? And maybe Artrice, you can kick off that one. So concrete examples, is the blueprint model the right way to implement this, or how should people think concretely about the next steps for their organization?
Are you asking for me to start or asking Artair to start?
I know, I said both. Honestly, do you want to start? And then Artair, do you want to go next?
That sounds great. And I love how sometimes you're combining our names together. I feel like Artrice is getting a kick out of that too. So
that's what happens when you're on the same team. You're not like, your names literally start with the same letters. So I think when we talk about this liberatory model, the reason why it's really a challenge to really get to specifics and say, here we are, we're in this, liberatory model. And even, as Kara said, even 201 San Diego has been working on this for almost a decade and is still working towards the policy and the practices and the ideal. And so, we're not going to be able to go to like say, oh, Amazon, that's your libertarian model. Obviously, it's not. I'm really using an example here. It really is about dismantling some of the the work around it, some of the dismantling some of this real structural racism, this real intentional bias that is created in our community. And so we talk about the liberatory model being the aspiration. We don't have all of the details just yet. We need to work towards it, because reality is we keep doing the same things over and over again, thinking that we're going to get a different outcome, and we do not. So what is it like to truly look at data and say, funder or government, I know you are requiring this, but why are you requiring this? Who is requiring this? Who is looking for this information? And why do they need it? Because often we collect so much information about so many different aspects of, and we never use it. It's just like literally in a file somewhere that we never utilize. And so someone asked the question, how do we, assess the need if we don't ask the question? We're not saying don't ask a question, just the opposite. We're saying bring the community into the development of the conversation, bring the community into the creation of the solution to their need, and we'll get more information than ever imagined, because the people who are actually in need are part of the development of the solution. So when we think about a liberatory model, we are truly thinking about those who are in need are actually building and developing what we're trying to solve. Artera.
Yeah, I think that's completely fair. I also think that we have to become real about our own biases. So a lot of times we're just not used to certain groups, and we need to be honest about that, being in decision-making positions. So we have a bias to seeing leaders be white men, and that's just a bias within our society. And so having checks to ask who is leading and why they're leading as well is something really important for us to move into a liberatory space. I think when we think about developing solutions around those who have experienced historical marginalization, for them not to be at the center of the space, it just doesn't make any sense at all. And I think that that's something that we have to be real about. It's just, where are our biases showing up? Why are people of color not in decision-making positions, especially around their own lived experience? And I think lastly, when we talk about something being predatory, and I think that was something, Rhea, that you brought up, one way that we know something is predatory, honestly, is if we don't see any benefit going to the most impacted community. And I think about the solutions that we develop in this space. And I'm just going to give an example, again, with the technology solutions. If we're seeing tech companies profit to a tune of, millions of dollars around this space, and the communities of color are in the same position, and it's off of their data, that's how we know something is predatory. There's no reason why we have such a mismatch in investment into solutions that are designed by and led by folks of color. And I think that that's why we have to be real about the biases that we bring into the space, because that mismatch would not exist if we were doing the reflection both institutionally and individually of how we show up.
I love that. So we only have 3 minutes left. So we're going to do a rapid 30-second round robin to this very last question from Mary Irvine. And some of the other questions we answered in the Q&A box. So if folks wanted to see the answers to questions, there are some in the Q&A box. So Mary Irvine directly addresses what you just said, Artera, which is, what about us who do this work? And so one of the things you acknowledge is that the folks who get to do this work is a group that is selected and filtered through our society's forms of racism. And so we have to think about first who gets to be in these roles and how do we rethink who's in these roles. But then Mary acknowledges that for someone like her or they, whose job permits them access to surveillance data for purposes of informing services, how is there a way to do the role respectfully? So for people who are already doing this, who aren't making the decisions, but are dealing with other people's data, what should they do? So I'll give everybody on the panel 30 seconds for this. We have 2 minutes, and then T and Rox will give us 30-second close. So let's start with Artrice, Arter, and then T and Rox with your 30 seconds, give us a nice close.
So with that data, I would be asking, why are we collecting this, and and who's using it, and who gets to decide why we collect it? Those are the questions I would ask.
And then I would ask who profits from this, and what does the reinvestment look like to people who we're taking the data from? So how can we actually use this to uplift the community? And that may change the way data is collected, used, and whatsoever. So that was my 30 seconds.
T, if you don't mind, I'll just pop in. I would also ask, like, how would it feel if you were on the other side of this? Would
Thank you,
willingly
Rox.
participate? Yeah.
Thank you. Yeah, I totally agree. You know, I was very impassioned by that last question. Just to keep it like 100, y'all. When you're asking for, and this is no shade because this is messy work, but when you're asking for concrete examples, just like Rox said, think of a moment where you felt marginalized. I don't care if you identify with, you know, the marginalized on the marginalized, but think about a time where you felt you received unfair treatment. Think about a time when you signed a contract and you didn't read the fine print. Think about that, and that gives you a concrete example. And I would say the other thing is that I have a family member. I don't see myself outside of the people that I work. Actually, I've been a benefactor of the services. I have people that are incarcerated right now in the state of California that they have a choice of reducing their time by becoming vaccinated. And wherever way you sit on being vaccinated, I'm for it. I'm for individual choice, all of that. But I just want you to think on that. And with that, I think Artrice, you and I are we teeing up for part 2?
Yes. So fortunately, we get to continue this conversation with you all in 2 weeks on this December 2nd. We will, Tini and I will be discussing a little bit deeper about how we apply this in action. And we see from a lot of the questions, it's really about examples. So that will help. We will make sure that we modify our presentation so that we can really kind of get to some really kind of a clear understanding for you all. There will be some pre-homework, and so I'll turn it over to T.
Yes, you said it all. I don't want to belabor. Thank you all for your time. We're honored with your interest, and I challenge us all to, you know, be our best selves. Thank you.
We'll be sending the slides out, so you'll have more information as we send the slides out from today's presentation.